Right now, we want to switch gears here at 9, coming up on 9:25, because as we head back into the back to school season, one other important topic that deserves our attention: childhood vaccination rates have really declined, almost 2.5% since 2020, leaving many families with questions about vaccine safety and necessity. So right now we are joined live here by Dr. Diana Howard from the American Academy of Family Physicians to help us really make some informed decisions about their children's health. Doctor, thank you for joining us this morning here on Live Impact News. Appreciate your time.
Good morning. Thank you for having me today. It's very important to discuss preventive health. So thanks for the opportunity.
Yeah, Dr. Howard, let's get right to the basics. And for folks and parents who are on the fence about getting their child vaccinated, what is the information and the message to them?
Well, first, I want to emphasize that vaccines work. They are safe, effective, and they save lives. The reality is that most of today's population does not remember what life was before vaccines. They have saved millions of lives, and they have critically advanced public health. Vaccines have been subjected to comprehensive scientific testing before they even reach the public, and they go through extensive research and safety checks. Now, if someone said that they don't want to get vaccinated because their immune system is good, I'll tell you that getting vaccinated also helps the most vulnerable people who can get immunized. We're talking about newborns. We're talking about someone that had a weak immune system. So we'll create a community of immunity.
Let's talk about measles, because that has been a topic, right, as of late, and the cases and data showing now that is going up. What's driving this increase, and then how serious is the threat to unvaccinated children?
So when we talk about measles, we should discuss two facts. One, that measles is a preventable disease, means that we have a vaccine that will prevent you to develop severe symptoms, be hospitalized, and die due to measles. Second, that measles was eradicated in the U.S. We didn't have to worry about it because we had a vaccine. Now, we have childhood vaccination rates that have been declining since the pandemic, and that opened the door for outbreaks of preventable diseases just like measles. Now, unfortunately, this has led to children being hospitalized, and we have 2 of them that lost their lives. And it's not because they did not have access to the vaccine, but because they chose not to. So we have good news for our parents. They have the power to protect their children. They can prevent them to get ill. We have a vaccine that can have access at your regular well child visit, get your MMR vaccines. And if you have any concerns, we will be happy to discuss that with you freely, without judgment. Now, parents need to be aware that if they choose not to vaccinate their child, it's not only that they are putting their child at risk, but also those around them.
Absolutely. I mean, really, we're talking about information versus misinformation, social media playing a role in that. As a family physician, how do you help parents figure out and separate myth from fact when it comes to vaccinating their kids?
Well, as family physicians, we know that our patients and their family have the best intention when they come to our clinic. You know, they want to do the best for their families, and it's confusing, it's overwhelming when they have so much information in the media. So to cut through the noise is difficult. So now your doctor can help you answer all those questions with scientific-based information for you to make the best decision for you and your family's health. Now, the best thing most people could do is reach out to the family doctor, schedule an appointment, bring all those questions, concerns. We will be there to help you.
All right. And one last question, Dr. Howard. Beyond childhood vaccinations, what's your advice for families trying to stay current now with vaccinations from groups from kindergarten up through high school?
So we have different vaccines scheduled for our patient's age. So we have some specific vaccines that have to be given before the school start, but also even if you are up to date with your vaccines, also depends on the season. So like now, we should recommend a flu vaccine to everyone. We recommend RSV vaccines for pregnancy, for children. Also, the vaccines before we started school, even if you know that your children has been behind vaccines, we have a specific schedule that we call it a catch-up vaccine schedule. So we will make sure that your children is up to date before they start school.
All right, very good. Dr. Diana Howard, representing the American Academy of Family Physicians. Thank you for all of that good information. Appreciate your time this morning as families get ready to go back to school for CMS here in Charlotte. Appreciate it.